Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, May the 10th. We're honored to be here on the territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, and Wednesday, we'll be providing our daily briefing in written form at around 3 o'clock, and then we'll be back here in the Press Theatre in Victoria on Thursday. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today we're reporting on 3 periods over the past weekend. From Friday to Saturday, we had 596 new cases of COVID-19 diagnosed in British Columbia. Saturday to Sunday, 605 new cases. And in the last 24 hours, 558 new cases of COVID-19 diagnosed. That brings a total of 1,759 people diagnosed with COVID-19 over the weekend, and our total in British Columbia to 136,100 people. Of the new cases, 325 are people who live in the Vancouver Coastal Health Region, 1,201 are people living in the Fraser Health Region, 50 are people living on Vancouver Island Health, 131 people are in Interior Health, and 52 are people in the Northern Health Unit. We now currently have 6,140 active cases around the province, of whom 415 are in hospital. 150 people in ICU or critical care, and 128,139 people have recovered from COVID-19 from their acute infection. We have no new healthcare outbreaks to report today. We do have one outbreak declared at the Sunrise Poultry plant in Fraser Health. And outbreaks have been declared over at the Surrey Memorial Hospital and Dufferin Care Centre. This leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care facilities. Sadly, over this past weekend, we've lost another 20 people in British Columbia to COVID-19, bringing the total number of people who've died in our province to 1,622. As always, our condolences and our thoughts and prayers are with the people who have lost a loved one, with their care providers, and with their whole communities. We know how challenging it is to have to mourn during this difficult time. I did want to give a breakdown of the age ranges of people who passed away this weekend. Sadly, it is again overrepresented by seniors and elders in our community, with 15 of the 20 people who died this past weekend being over the age of 70. 15 over the age of 70 entirely, 5 of those 15 people being seniors in our 80 to 89, and 1 being a person over age 90 who died at a long-term care home, sadly. We've had 2 younger people in their 40s who've passed away this weekend, 1 in Interior Health and 1 in VCH, and 2 people in their 50s. And having an age group doesn't represent each individual who passed away this weekend from this virus. It just helps us recognize that nobody is immune, and that this virus still has a tremendous negative impact on our seniors and elders in our community across the province. On a more positive note, to date, we've delivered 2,159,103 doses of all 3 COVID-19 vaccines in BC, and 106,058 are second doses. But this means that over 2 million of us in British Columbia have now received their first dose of their COVID-19 vaccine, and I think that's a tremendous accomplishment. The focus of our COVID-19 response is to get all eligible people in British Columbia vaccinated with their first dose and then fully vaccinated with their second dose as soon as we possibly can. To do this, we need everyone to go on the Get Vaccinated website and register, whether you have received your first dose already or not. This ensures your dose is reserved for you, and we can get it to your clinic as soon as it's available for you. For those who have received their first dose before the registration system began in early April, we ask you to take a few minutes to get registered today. If you received your first dose at a pharmacy, it's also important that you go on, get vaccinated, and make sure you're registered there as well. And if you're already registered, I ask you to please encourage and help your friends and family and colleagues to do the same. Our immunization program is rapidly accelerating, and we are receiving more and more vaccines. This means we can move down our age-based program very rapidly in the next few weeks. Starting later this evening across the province, anyone who's 40 years of age and older will be able to book their vaccine, their appointment. Additionally, all adults, those 18 years of age and older who live in one of our identified high-risk CHSAs, can book their vaccine starting later today. Text and email alerts will be going to everyone who has registered. So if you've not yet registered, please do that right away. This is the most efficient and fastest way to get your vaccine. Understanding the progression of this pandemic and knowing the risks for our loved ones and ourselves is important for everyone, and it has been the focus of our work in public health with our public health surveillance from the very beginning last year. The BC CDC is the organization that works on behalf of us in the province, of our public health community, to collate all of the surveillance data that's collected on an individual level from the public health workforce across our province. And what we do is we pull that data together at the BC CDC, review it as a community to make sure that we are making the best information available to ensure we make the best possible decisions to manage this pandemic on an ongoing basis every day. We also share this information in many ways to the public across British Columbia through the daily briefings, the statements that we put together, our weekly BC CDC surveillance reports, which have detailed information on the epidemic trajectory, on case rates, on age ranges, on hospitalization data. And I would encourage everybody to go on the bccdc.ca website and click on COVID-19 data. And in there's a section called the COVID-19 Epidemiology app. Along in that section, you can look at all of the comparisons that we have around within BC, comparing BC to other parts of Canada, looking at our testing rates, the testing rates by different areas of the province, and all of the information that is helpful to understand where you fit and where your community fits in this pandemic. In addition, we present data at least monthly with our monthly modeling reports, and public health data is available for everyone. This information is made available, however, once it has been analyzed and reviewed by public health scientists, researchers, and leaders from across the province. And that's a process that's ongoing. Since last January, we have been meeting, we have data meetings weekly, where we review all of the different types of data that we have coming in from our public health surveillance system. This changes over time. And as we have progressed in this pandemic, the type of data that we've collected, the level of data and the numbers of people who've been affected have meant that we've been able to change and modify the types of information that we can provide both publicly and use to inform the decision making that we do. More recently, as we've entered our third wave and cases have surged again, we've reached that number of cases in many different areas of the province. We are now able to present data by a more granular level, and that granular level is the community health service area. We have been reporting, as you remember from the very beginning, by health authority, then by health service delivery area. Then as we had more cases, so information was less identifiable, we changed to local health area. And since early April, as cases surged again in this third wave, we've been able to modify the data and link so that we can provide information on case rates and now, very recently, on immunization rates mostly by community health service area. And these maps were approved for distribution after we had discussed them and analyzed which were the best cutoffs to use and which would how to best present that information. And they will be available publicly on the BC CDC website with our updated surveillance data on Wednesday this week. We will continue to update them, and we have been working on developing an interactive mapping app so that you can actually look at different neighborhoods by both age and sex, and that will also be available in the coming days. While we work to release as much information as possible, we do have very rigid legal and ethical requirements to ensure an individual's personal health information is not compromised. And this is a protocol that we've worked out to be able to publicly share personal health information that's been available for many years through the BC CDC, and it's those guidelines that we follow when we release information on this pandemic as well. So I encourage everybody to continue to look at the BC CDC website, and on Wednesday you'll be able to look at more granular detail mostly by community health service area. And I say mostly because there are some smaller population centers in the province, mostly rural ones, where we only can present by local health area because the community and parts of the community can be identifiable. Our priority is and always will be making the best decisions with the best data that we have, the public health response, identifying and stopping chains of transmission in our communities. And I know people in British Columbia would expect no less. There are many different types of information or data that people are looking for that we may not have in our ongoing systematic surveillance. These include things like race-based data, disaggregated data based on race, on workplace data, and on school data. When we put those information together with what we can provide, we present those at our monthly modeling meetings, and I've done that with the school data as best we can. We have some workplace information that we post online as well. And we get at some of the other important information that's not collected in routine surveillance by looking to gather it through other means. One of those, for example, on the important issue of disaggregated data, is through our SPEAK survey, where we understand the impact not just of COVID-19, but also the measures that have been put in place to control the pandemic on different communities, different racial groups across the province. When it comes to data as well, raw data for researchers, as most researchers are keenly aware, there is a rigorous and detailed protocol to make sure that data sets are used appropriately and that ethical approval is in place. This is a well-established protocol that is in place to ensure the protection of confidential information for every person in this province. And we are very proud in British Columbia. We've developed a strategic research advisory board that has led the coordinated response of a number of different research networks across this province that has put BC in a really good place to understand things like which medications work best. We have a critical care group. We have a group that's focused on looking at the impacts of the pandemic other than the COVID-19. We've looked at schools, we've looked at the unintended consequences, as we've called them. So these networks continue to be active and to share data. We know that the modelers that are part of our teams and part of these networks are informing the modeling that we present to you at least monthly, as we have since January of last year, and we will continue to do that. As well, these data are used at a local level with public health leaders in every community, connecting with their communities with the information those communities need. While we continue to accelerate our province-wide vaccine program, the foundation for all of us right now needs to be to continue to follow our COVID-19 safety basics. That means staying small, staying local, following all of the public health measures, and using our layers of protection always. We are moving in the right direction, but as you can see by today's numbers, COVID-19 continues to spread in our communities. which means the risk remains high for all of us right now. But as the number of people being immunized increases and our immunity catches up after several weeks, we will be able to start thinking about our post-pandemic future. We know that that is coming. Immunization is going to get us there. But we are not yet at the point we can ease up on the restrictions we have in place. But we are getting closer every day. Finally, I just want to acknowledge that this is National Nurses Week, and today is Indigenous Nurses Day. And I just want to commend the bravery, the perseverance, the courage, and the compassion of all of my nursing colleagues who have been through so much in this past year, this past 15 months. We are in awe every day of the work that you do. And I just want to say my thanks and gratitude to all the nurses across this province. Finally, we are getting to a better place in this pandemic, but we cannot let our guard down right now. We know that we're not safe until everybody is protected, and we need to continue to work as a community to support each other by being kind, by remaining calm, and staying safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by passing on my condolences, those of the Premier, the government, everyone in BC, to the families, the friends, and the caregivers of the 20 people who passed away related to COVID-19 over the last 3 days in BC, 12 from Friday to Saturday, 4 from Saturday to Sunday, 4 from Sunday to today. People passed away in every health authority in the province, 8 in Fraser Health, 5 in Interior Health, 1 in Vancouver Island Health, 1 in Northern Health, and 5 in Vancouver Coastal Health. And I want to say to all of those people, because we continue, of course, to have restrictions that limit our ability to come together and to grieve, that we're thinking of them today, that we're grieving with them. I wanted to also join Dr. Henry in recognizing National Nursing Week, Indigenous Nurses Day, and all of the people working in our healthcare system, particularly right now in acute care. As Dr. Henry has said, we have 415 people hospitalized with COVID-19 right now in BC, and that number is less than it was this time last week when it was 474, but it is still extraordinarily high. We do have our occupancy rates in our acute care hospital across the system in terms of base beds. Our occupancy rates are 91.6%, and with respect to the surge beds that are in place, it's 4.5%, meaning there are 774 vacant base beds and 2,495 vacant surge beds. But to put another way, 118 surge beds are in operation, which is a significant challenge, particularly in the Fraser and the Vancouver Coastal Health Authority. With respect to critical care, we have 101 vacant base beds, which is an 80.2% base bed occupancy rate at the moment. Our overall occupancy rate is 58.2% when surge beds are counted. That means, as I say, 101 vacant base critical care beds and 203 vacant surge beds. 15 surge beds are currently occupied. So this reflects, I think, while the situation is better than last week, the extraordinary challenges facing our nurses, our doctors, our health sciences professionals, our healthcare workers in acute care, and why we need to continue to do everything we can to follow public health guidance and public health orders. I wanted to note with respect to immunization and just bring you up to date on what we're expecting from Canada in the next few weeks, which provides a vaccine through our national system to British Columbia. Last week, the week starting May the 3rd, we received 274,950 doses of Pfizer. At the end of last week, we received 135,600 doses of Moderna. That was early. That was the doses we expected this week. This week, we're expecting 274,950 doses of Pfizer. Next week, the week starting May 17th, 276,120 doses of Pfizer. And at the end of that week, after May the 20th, 141,300 more doses of Moderna. Then in the final week of May, full week of May, starting May 24th, we're expecting 273,780 doses of Pfizer. What that tells you is that significantly a lot of vaccine is coming to BC, and the importance of getting registered now. And Dr. Henry has gone through the age cohorts that will be available to book their vaccination appointment, dropping day unto day this week, and dropping to 18 plus in the community health service areas that are considered hotspots in BC. That this is the time to register, and this will be available. The detailed numbers will be available by age cohort in our statement today. But total vaccine registrations in BC is 2,391,122. But what is gratifying, and this reflects the work of everyone in the community over the past week, the Premier's been involved, MLAs have been involved, members of Parliament have been involved, community groups have been involved, businesses have been involved. In the last week, since last Monday, 389,299 new registrations, which is a real achievement. But it tells us that there's still more. We know there's still more people to register, and now if you register very soon thereafter, you'll be in a position to book. So register at the Get Vaccinated website in BC and register today. I wanted to say finally, with respect to vaccines coming into the province, people will know that the Johnson & Johnson vaccine, of which we are expecting 40,000 doses, has not arrived. That's awaiting. Its shipment to BC is awaiting Health Canada approval. I wanted to say that, COVID-19 continues to pose a whole community threat in BC. Our best and strongest response has to be all community as well. This has been our approach in BC, and it works. For the vaccine to do its best work, it needs to be where it's most needed. That it has been in our most vulnerable people, and now in areas as well of high transmission. It needs to be made available, it needs to be made accessible to get shots in arms as fast as possible for each of our communities, particularly those under threat. That means our action may not always be smooth. At times it may be awkward and cause us inconvenience. But this is a pandemic. It's a new road for all of us, and we must travel it at speed. What matters is the intent. Make people safe with care and compassion, whatever it takes. Right now, BC communities, all of them, are counting on all of us, and we're counting on them to keep fighting COVID-19's tight grip. That's our duty right now, and that's how BC fights COVID, all in all of our communities. Je voudrais dire en français qu'aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence. Pendant le week-end, il y a eu 20 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1622 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 596 nouveaux cas. Pour la deuxième période de référence, nous avons eu 605 nouveaux cas. Au cours des dernières 24 heures, 558 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 415 personnes sont actuellement hospitalisées, dont 150 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. First question, we go to Binder Sajan, CTV.
With restaurant workers now getting vaccinated in Metro Vancouver, right after the long weekend is when that immunization should be kicking in. And I know we are still seeing hospitalizations at a high rate, unfortunately deaths this weekend as well. But I'm wondering, with them vaccinated, does it open the door to easing restrictions on indoor dining? And if not, what else are you looking for before that could happen?
Yeah, so just to say that it's not just in not just in Vancouver, but yes, we are looking at the worker program, and many workers in the risk workplaces, including food and restaurant workers, which is great, are now getting their vaccines, and I think that's really important for their own protection, knowing what has happened in this last few months. And yes, we are looking at what is going to happen, how we're going to transition, and we will have many more details on those in the coming days. But certainly one of the things we want to get back to, as soon as it's safe to do so, is indoor dining. We know how important that is for restaurants, but it's also an important safe place when rates are low in our community, and when people are protected through immunization. So yes, we will be talking more about when the restrictions that we have in place are going to be lifted and what that will look like in the coming weeks and months. But we're not at that place quite yet.
Binder, do you have a follow-up?
I do, and along with that, grocery store workers are also being fast-tracked for their vaccines, but it's only those who are 18 and older. So this leaves out some teenagers who work in these establishments. And so with Pfizer being approved for everyone 12 plus, why can't all restaurant and grocery workers get vaccinated now, even the ones who are younger than 18?
Yeah, so, this is, that was just approved for use by Health Canada last week. So we have had ongoing discussions, and more of them today, about how we factor in 12 to 17-year-olds in our program. But the age-based program is based on risk. And yes, we are moving down that age cohort as quickly as we can, and we will have more information on where 12 to 17-year-olds fit in that program in the coming days.
Next question, Katie DeRosa, Vancouver Sun.
Henry, I'm just wondering, is the province talking to Saskatchewan about its reopening plan? It's the first province to release sort of a 3-stage gradual reopening by early July that would be based on the number of people in each cohort who are vaccinated. What is BC's, discussions with Saskatchewan, and are we looking to a reopening plan similar to that?
We had many discussions nationally with my counterparts across the country, though I will say that Saskatchewan's plan came out a little bit of a surprise to most of my colleagues, our CCMOH colleagues, and we did have an ongoing discussion about that yesterday on our usual Sunday call. Here in BC, we have always had our own restart plan, as we had the first, and we have been working across government with advice from public health, and it's being led by the deputy for the premier, but with all of government and our stakeholders for our restart 2.0, if you want to call it that. We do need to look at a number of different factors. So it's not going to be just based on immunization, but that will be one of the important factors. And I think we can look what Saskatchewan has, what the UK has put out, the modeling that we've seen both here in BC, but also nationally, that shows that once you get to a certain level of immunization of adults in particular, that we start to see a rapid decrease in transmission. So we will be looking at all of those things. The important things that we need to really keep in mind are the goals of our pandemic response. The number one goal is to reduce morbidity and mortality, so sickness and death from this virus. And immunization is one of the most important tools that we now have to do that. The second is to make sure we're not overwhelming our healthcare system. And right now, we still have very high rates of hospitalization, as you know, and of people in ICU. So we need to balance that over the next little while. And then, of course, we want to minimize the disruption that we are having on society. So all of those things will be considered, and we will have more details. We are absolutely talking with our colleagues across the country, but very specifically charting our course here in BC.
Katie, do you have a follow-up?
Also, in terms of data, will the province be releasing more detailed data on transmission or infections inside schools and also daycares? Because we haven't really seen much around daycares. Like, are we not seeing any transmission in daycares, or in those two areas? What kind of data could be released further?
So, as I've said many times, we don't have the type of information that I think everybody would like to have, which is exactly who transmitted to who in every school and every daycare. We do have some higher level information, and we've had some deep dives that have been done in both Vancouver Coastal and Fraser Health in particular that we've presented to people. We do have an overall number of people who work in the childcare sector, and we have had some small outbreaks and transmissions in childcare centres, and that is one of the reasons why childcare workers have been prioritized. And I think that's a really good point. Childcare workers and school staff have been prioritized for immunization, and immunization has been very high in school staff across the province, less so in people who work in childcare. So I would really encourage people who work in the childcare centres around this province who've been doing so much good work caring for children, especially for children of essential workers and others around the province. Now's your time. You have access to vaccine across the province. Please go and get vaccinated. In terms of the data that we have, unfortunately, our surveillance data is limited in both those areas, so we will present and continue to present what we do have.
Next question, Richard Zussman, Global News.
Saskatchewan's plan is very much based on vaccination, just like Katie was asking. You mentioned that ours would include other things other than vaccination. Can you explain what that is? And do you believe that having a reopening plan like this will provide an impetus for people to go get vaccinated, or something for people to look for specifically around when they can do certain things like, go to an event or go to a library with higher capacity? Do you think it would provide some additional support for people towards that goal?
Well, I think there's really two things about it, and we want to look at where where it has been most impacted, and of course, we look at food and restaurant and tourism and those sectors, but we also look at where things have worked really well. And here in BC, we've kept most retailers open, especially small retailers. We've been able to keep many businesses functioning safely with the COVID safety plans. So a lot of our work will be focused on those sectors where there needs to be specific things, and then we'll be looking at the 7-day rolling average of cases, the information that we present regularly that's on the BC CDC website. We'll be looking at hospitalizations, people in ICU. We'll be looking at the morbidity and mortality, how many people are in hospital, how many people are thankfully fewer and fewer passing away from COVID-19. So immunization does two things. One, it has a personal benefit for me. I'm protected from my own personal health, but it also has a community benefit. So immunization rates are just one of the factors, but a really important factor. And yes, that we will be looking at a vision of where our post-pandemic world is going to be, recognizing that this virus is going to be with us for some time. We don't know how long, likely years. It may be a time when it turns into yet another respiratory virus that doesn't cause severe illness in most people. And that's where we hope to get with immunization. So part of our restart plan will be, how do we gradually go back to those important things that we've missed in our lives over this past year? How do we do that slowly, recognizing that not everybody's risk tolerance is the same, and we need to get more comfortable with larger numbers, doing more things in more places, and there'll be a transition period as we learn as we go over the next little while. But we have, and I think you can look to the UK, who's several months ahead of us in terms of both the immunization rates and reopening. And if you do things too quickly, we know this virus can surge very quickly, even in people who are immunized. So we need to look at what we can do personally with a small group of people once we are all protected, are relatively protected, and then what we can do as a community, whether it's in a workplace, whether it's in having social gatherings at a larger amount. And I think it's safe to say that we can be looking at going up to larger numbers of people being able to gather for important ceremonies. Last summer we had the limit of 50, and that was a good transition for a period of time. Then we can look at larger numbers. So it is More details will be coming, of course, but I think it's important that there is a vision for us getting out of this pandemic and getting back to those important connections in our lives.
I know you'd expect me to say this, Richard, but I think it's important to live in the present as well. Right now, it's very important. What we've seen over the weekend is better than what we saw before, but still 596, 605, 558 cases, still 415 people currently in hospital, 20 people passed away over 3 days, 150 people in ICU. And that means we have to be in the moment now. I know Saskatchewan's plan, and one thinks about the next phase, but we've got to live very much in the present right now. And that means following public health orders, following public health guidance, getting registered and getting vaccinated. If we can do that now, it opens up opportunities later. Well, we got to remember the present is not the opening up. The present are the orders that are in place, the guidance that is in place, sticking local, and doing everything you can, and getting vaccinated, getting registered, and getting vaccinated.
Richard, do you have a follow-up?
Dr. Henry, you mentioned positivity rates. We're seeing different levels of positivity and different caseloads in different parts of the province. Is there any way, as part of this reopening, that we would have a regional approach, i.e. people in areas of lower transmission would be able to do things that places with higher transmission would not be able to do? And to Minister Dix's point, he says living in the present, how much heads up will you give to restaurants and other industries who will need to hire people back as they move back to a transition to normalcy?
Yeah, so that is something that we have ongoing consultations. My office has met every 2 weeks pretty much for the last year with people like the Restaurant Association. So those are ongoing discussions. We understand for many different industries there's a lead time that can be weeks to months depending on where we're going. So yes, we will continue to have those consultations and give people the lead time that they need. I'm sorry.
Will they get lead time in from the decisions?
But you had another question at the beginning, which I've lost. I'm sorry.
Yeah, regional. Whether different restrictions would be in different places based on.
I think we have learned through this. We've tried on 2 occasions to do things regionally and recognize that we are connected across this province and across this country in many ways through travel. This virus is a virus that spread from people to people, and our risk goes with us from where we come, and we take it to where we're going, and we take that risk back with us. And we can see, we only need to look at my colleagues in Nova Scotia right now to see that things can change very, very quickly with this virus. So we have always, we've maintained an approach of doing it together here in the province, and I don't see that changing. We've seen that this virus can cause dramatic effects in many communities across the province, and we're not yet at the point where we have enough immunity across the province that we can do things differently. So a consistent approach has worked for us and will continue to work for us. If we learn new things, and if we get to a place where there's evidence that supports doing things differently in different communities, then we will continue to look at that. But right now, I think we can expect to go through this next phase together, as we have been for the last year and a bit.
Next question, Marcella Bernardo, News 1130.
Thank you, Dr. Henry and Minister Dix. I'm going to start off by asking you about the timeline for second doses. And if you could explain why people who received their first dose of vaccine in the Vancouver Coastal Health Region are now being told to make sure they're registered if they book their first appointment by phone before April 6th, and what outreach is being done to ensure that they get their second dose before that 4-month mark.
Yeah, so as you know, we increase the dose interval, and at that to make sure that the strategy is to make sure we can get as many people as possible with their first dose as quickly as possible. And as in a time of limited vaccine supply, that was our most efficient way of getting community protection as quickly as possible. And many people are now coming up to that 4-month period, and what we have done is loaded the information about those people into our provincial system. So we've always had a provincial immunization registry. This is something that I fussed about quite a bit, so that we know every single dose of what vaccine went into whose arm. So we know who has Moderna, who had Pfizer, who got AstraZeneca. But our registration system has names but not contact information necessarily. So we are doing outreach to, it is a lot of people in long-term care and in many of the First Nations communities that had immunization by community. You will be contacted by your community. We are going back into long-term care homes and providing second doses for those who have not yet had them. Those things have started now as we've reached that point where many people are at, we've started it at 13 weeks versus 16 weeks to make sure that we can get those second doses prior to 16 weeks. And healthcare workers were first in line, older people were first in line, and so we'll be reaching out to them and have been over the last little while. You can see that the numbers of people with second doses is starting to increase, and starting next week that will go up in much larger increments as we reach that period of time where we started to get more vaccine at the end of February. So yes, those are happening. If you were somebody who got your dose, the most efficient way to get your second dose is to register now at Get Vaccinated, and that will make sure that you get your notification soon.
Marcella, do you have a follow-up?
I do, and this one is more for Minister Dix because of the political fallout from the leaked documents last week, further eroding public trust in authorities. Now we have frontline workers becoming anonymous whistleblowers of information that we, as journalists, have spent months asking for. If Minister Dix could just address how you hope to restore that public trust in what you're telling us at these briefings is what we need to know.
Well, I mean, I know you want to hear from him, but I can't tell you that this is surveillance data. We have from the very beginning shared that with a wide variety of our team members. There's over 100 people that are on our listserv for that information, and then it gets loaded up onto the BC CDC website. So all of that so-called leaked information is information that we've been sharing that's publicly available and more. You know, the VOC report is on the BC CDC website. Our adverse events following immunization report is on the BC CDC website. What is new, and what I've said today we are going to post publicly, is replacing the LHA maps with the heat maps now that include, for most areas, community health service areas. As we've had more cases in the last month, 6 weeks, we now can go down to a smaller geographic area, and those maps will be posted on Wednesday. They were approved by me to be posted about a week and a half ago. We were trying to get the process so that we could have them more interactive, but that has not been able to be pulled together quite yet. So we'll be posting the static maps, and then as we develop the interactive system, we'll post that as well. So that information is there for people, and we have been trying to get it out as widely as we possibly can. So I want to reassure people the first and primary role of the surveillance data that we collect is to make the best decisions from public health that we can, and that means sharing it widely with public health professionals, with researchers, with scientists, so that we best understand it. That's the primary purpose of the data, and that's how we use it at a local level, on a one-to-one level with public health, and at a provincial level to make provincial decisions about our program. And then we post as much as possible publicly so that everybody can see the data as well.
Thanks, Marcella. I mean, what we've done in British Columbia, I think people can count on this, is having our public health professionals lead the public health part of the campaign and providing full, constant, and full-throated support from the government for that effort, and that continues to happen. The leadership of Dr. Henry, of Dr. Gustafson, of all of our teams. With respect to the document from last week, you'll know that almost, I think there were 4 pages of the document that had information that wasn't public last week, and that will now be provided publicly. Those maps in question will be provided publicly. And over time, we provided more and more information. The regular and daily briefings on case counts, the presentation of information daily by the BC CDC, weekly, the surveillance data by the BC CDC, and we've consistently listened and provided more information when it's required. You'll recall, Marcella, one of our discussions some months ago was information about outbreaks in long-term care. That information continues to be provided every Thursday. It's no longer of as great an interest. Equally, information on PPE, on the surgical renewal plan and others has been provided in detail. That's what we've been doing from the beginning. But I think what people have confidence in and what's worked in BC, and it's a difference from other jurisdictions, is the strong support of the Premier for public health in what is a pandemic that's unprecedented in our time. And I would say that here in British Columbia, our mortality rate less than half of the national average. In other words, less than half of the average of the country, the average provincial rate in the country. The lowest mortality rates of any North American jurisdiction, above 5 million people, are jurisdictions in our category. It's pretty. It's been a significant effort, and I would say that effort reflects, I think, the response of regular British Columbians to the consistent and thoughtful and generous message of Dr. Henry and her team. And I think that's going to continue to be the case. And I know that there are challenges from time to time, and we learn from those challenges, and we just keep going forward. And you've seen us adapt consistently through this pandemic, and we're going to continue to adapt in this phase of it as well. But what I want to say, and what's really important, what I've been communicated personally for months, is that COVID-19 is a vicious virus that we have to take care for ourselves, for the ones that we love, for the people in our neighborhoods, and for the people we don't know. And that means the guidance provided by public health and the orders provided by public health need to be followed, especially now, and that we really need people to get vaccinated. You see the changes today, how vaccination is opening up to more and more people, but you need to register to get vaccinated. And I really encourage people to do that. And I think the response on the ground to the call by the Premier to register, call by Dr. Henry to register, the call by leaders from all political parties to register, the call from community leaders, 390,000 people registered last week and more to come this week, is an indication of where the public's at. They want to get vaccinated, and in their vast majority, they're following public health guidance and orders.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For the final question, we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, there are now almost 1.5 million British Columbians who are more than 2 weeks past their first dose. And while it may be some time yet before we can, say, gather in large crowds, when is guidance going to change for people who've received that first dose for more than 14 days now, at least, in terms of what they can do now? For example, can two people who both received that first dose several weeks ago spend time together inside?
Yeah, this is not 100% vaccine, and we've seen that in other jurisdictions around the province. We've seen that in long-term care. People can still get infected even after 3 weeks, after 4 weeks, when we have so much virus still transmitting in our community. So right now, we're not at a place where any of us can let our guard down, but we will be there. And we will be there in a matter of weeks now, not months anymore, but weeks. So I implore people right now, stay the course. Keep using the precautions that you need to use. We know that we are immunizing people rapidly, and we will get to that point where it's safe for us to start doing those things we really want to do again, both on a personal level and on a small-scale community level. So right now is not the time to take those risks.
Tanya, do you have a follow-up?
Yes, and I forgot to ask earlier if we could get Minister Dix to respond to those questions in French. That would be greatly appreciated. Can you speak to the effectiveness of the highway road checks so far? It seems as though no fines have been handed out, only a handful of cars turned around. Do you consider that an indicator of success?
I do, and maybe Minister Dix can speak to this. You know, I think it really is, the deterrent is the fact that people are out there paying attention to this. And I think it was something that we needed to put in place to remind those small numbers of people that felt that these didn't apply to them. So I thought they were very effective in the fact that we tell people ahead of time where they're going to be so that you know. And hopefully that deterred some people who felt that these rules didn't apply to them. It's very important for us to get our transmission rates down as we're getting people more and more protected so that we can get to that next phase of post-pandemic life and start doing things again that we really need to do as social creatures that we are. So I hope that people will continue to follow that guidance and that we'll be able to move to a better place very soon.
Thank you. I think the idea is not to fine people. The idea is that people not to take part in non-essential travel, not to travel right now. And that, I think to that extent, the measures put in place by my colleague, Minister Farnworth, have assisted in communicating that message, and you see the result of that when you observe what's happening at the various checkpoints that have been in place in BC. Again, not about the revenue, it's about people not traveling, and this is the time not to travel, not to engage in non-essential travel right now. And I think that message has got out very clearly, and I think the effort that has been led, and we're very appreciative of the frontline, especially police, who've been assisting people with that, I think, in making that happen. So je dirais en français que la raison d'être de nos actions c'est de réduire le déplacement des gens un peu partout dans la province pour des raisons non essentielles. Donc, je pense que, à notre sens, ça marche. S'il n'y a pas de punition, mais une grande réduction dans le nombre de gens qui voyagent dans la province, un peu partout dans la province, ça c'est une très bonne chose. Pour les autres, pour les gens qui sont vaccinés, il faut forcer de reconnaître que la vaccination n'est pas à 100%, n'est-ce pas? Et donc, il faut maintenant, surtout maintenant, que tout le monde suive les conseils, suive les règles de la santé publique, y compris les gens qui ont été vaccinés. Ça, c'est essentiel, surtout maintenant. Il faut vivre dans le présent. Et le présent nous dit très clairement qu'il faut suivre les règlements actuellement. Il faut suivre les conseils maintenant et de se faire vacciner à la première moment possible. Merci beaucoup. Thank you very much. See you on Thursday.